And so this panel plans on taking a deep dive into their thinking on the future of nursing 2020-2030, charting a path to achieve health equity and the strategic planning held by the coalition's core leadership team. I'm sure many of you will have questions of this panel, and so remember to populate Q&A in Zoom. It's that feature down below right by the chat. You'll see that Q&A, and you can populate that. Our moderator for our panel discussion is Dr. Benita Chapman. Dr. Benita Chapman is an assistant professor and assistant dean for clinical nursing education at Louisiana State University Health Sciences Center in New Orleans, Louisiana School of Nursing. Dr. Chapman is a certified nurse educator, as well as a certified adult and youth mental health first aid instructor. In addition, Dr. Chapman is an evaluator for Commission on Collegiate Nursing Education. She was recently accepted into the Health Equity and Anti-Racism Leadership Institute, also known as HERE. She has served as the Director of Membership, Recruitment, and Retention for Louisiana State Nurses Association, and now serves as President-elect for LSNA. Welcome, Benita.
Well, thank you, Denise. Thank you so much for that warm welcome. I am actually very honored to be here today among some very esteemed colleagues of mine with an assortment of experiences in the discipline and profession of nursing. I would have Kelsey to drop the booklet back into the chat that he did previously so that you all are able to read our panelists' extensive bio if you have not already done so. So I would like to start off by going ahead and introducing Dr. Demetrius Porce. Dr. Porce is a professor and dean of Louisiana State University Health Sciences Center in New Orleans. And he's also currently serving as our interim vice chancellor for academic affairs. Dr. Porce is going to have the opportunity today to provide us all with an overview of Louisiana Action Coalition strategic plan before we all start that panel discussion. I'd also like to go ahead and introduce Dr. Cynthia Bianami, who is the owner and CEO of the All Things Professional, LLC. She assists employees of healthcare workforce professionals, workforce centers, professional licensing boards, academic institutions, and other interest organizations in describing and addressing issues related to the current and future healthcare workforce through the use of quantitative as well as qualitative data. Dr. Bianami will be providing us a perspective on really creating a diverse workforce in Louisiana. We also have the pleasure of having Dr. Karen Lyons, who's currently serving as Chief Executive Officer and Appointing Authority of the Louisiana State Board of Nursing, where she regulates over 71,000 RNs as well as over 8,000 APRNs. She will be providing a perspective of strengthening our workforce capacity. And then finally, we have Dr. Ikoy Rooney, who has served more than 20 years as a nursing leader. She's recognized expert in forensic nursing and nursing leadership. She's currently the Director of Nursing Leadership Development for Ochsner Health and the President of the Louisiana State Nursing Association. Dr. Rooney will be giving us and providing us perspective from the influence of health policy. So let's welcome our panelists. All right, so we're going to go ahead and get started, and we'll start off with allowing Dr. Porce to provide us an overview of the strategic plan for the Louisiana Action Coalition.
So what we're going to cover, next slide, please. What we're going to cover right now is the Louisiana Action Coalition strategic map. And as you can see, the strategic map has been planned by the core leadership of LAC for the next few years, 2022 to 2025. And when we look at the strategic map here, you'll see the oval circle in the middle. This oval circle represents what the core leadership team has identified to be the core challenge for the Louisiana Action Coalition. So the core challenge is to be the conduit that engages stakeholders, and that represents all stakeholders, nursing and non-nursing, to collaborate with nursing to achieve a culture of health and health equity throughout the state of Louisiana. And I think the key words here are in this phrase for the central challenge is that they're going to be the conduit by which we bring people together to collaborate and hopefully advance health and health equity. So how are they going to do this? So 4 areas of priority have been identified to do this. And the buckets of work pretty much are in 4 areas: workforce, access to care, nurses' involvement in policy, and of course, increasing the visibility of Louisiana Action Coalition. So I'm gonna go through each one of those a little slower, and under each of the priority areas, which are labeled A through D, you have objectives under the priority areas. So the first priority area dealing with workforce is to strengthen and prepare a diverse nursing workforce. So the 4 objectives that the core leadership of Louisiana Action Coalition has identified is to really look at having and promoting innovative programs for nursing education and making sure that we're using best practices within nursing education. The second objective area, or strategic objective in that area, is to make sure that our nursing workforce, the current nursing workforce, has career progression within the profession. The third objective area is to create and foster opportunities so that we can make sure that our nursing workforce becomes more diverse, as we've heard throughout our discussion this morning about the Future of Nursing report. And then the last area, we know that the pandemic and then also the recent natural disasters that our state has experienced, nurses are very stressed and we need to take care of ourselves. And I think that 4th area is really looking at supporting the health and well-being of current nurses, the entire nursing workforce. And I would also say that also includes our current nursing students who are enrolled in our nursing programs. So our second priority area is improving access to care across the state. And how we plan to do that for objective 1 is to educate nurses and the stakeholders about what barriers of care actually exist, particularly in our communities within Louisiana. The second strategic priority area is to facilitate the removal of all those barriers and ensure that we also focus on the barrier full practice authority, making sure that everyone can practice to the fullest scope of their license. The third strategic area under access to care is collaborating with our stakeholders who already have telehealth within their healthcare system and making sure that we advance telehealth into all communities, particularly focusing on rural communities. And then the last area we have for a strategic objective for access to care is partnering with those organizations that already are doing something around the social determinants of health and making sure that we partner with those stakeholders and organizations to help expedite what they're doing and expedite what we want to do also to improve that access to care in various regions and parishes throughout our state of Louisiana. Moving on to our third priority area, and that is really positioning nurses to be able to influence policy regarding health equity and those social determinants of health. So the first thing that we really need to do as far as a strategic objective is to really build consensus around what is nurses' role and define that role for us as to what is our role in ensuring that health equity exists. And once we've done that, hopefully we can gather together with the next objective and build a unified voice with our stakeholders, collaborating with them to make sure that we promote health equity and address the social determinants of health that's impacting health in our citizens of Louisiana. And then the third strategic objective is to initiate public dialogue to identify health inequities and offer solutions. Really engage in some type of dialogue with our community who's experiencing these health inequities firsthand. And then the last priority area is to really look at the coalition itself, and that's to increase the coalition's visibility and value. And the first thing we have to do is really ensure that all of the stakeholders within our state understand what is the Louisiana Action Coalition, what do we do, who's the core leadership, what's the Action Coalition made up of, and make sure that our vision and values are really understood by all of our member organizations, but also the broader community at large too. The next strategic objective is conducting outreach to boards and other businesses so that we can really gather support for the Louisiana Action Coalition. The third strategic objective is develop and implement a strategic communication plan. To be able to do this effectively and communicate who we are and what we do, we need to have a communication plan in hand. The fourth strategic objective is engage our regional action coalitions in increasing our action coalition visibility and value within their communities. Having those regional action coalitions throughout the state can really embed and hopefully create an inclusive environment of the action coalition. And then the last is to collect and disseminate and promote related efforts happening across the state. That's really just to help communicate everything that's happening around health equity and social determinants of health around the state through the Louisiana Action Coalition. So there I present to you the work of our core leadership team and their strategic thinking and the direction they're setting for our organization. So I'll turn it back over to you, Dr. Chapman.
Thank you, Dr. Porsche. And I'll tell you all, when we went through this strategic planning, it was a planning session, and they have done a lot of work for us to be able to present this to you today. So your panelists are going to have the opportunity to actually go through some of these segments. And so at this point, currently, the nation faces a shortage of over 510,000 nurses. That is really further impacting secondary to the pandemic that we're all experiencing. In addition, the nursing profession and the population is aging, and we will see that an additional about 4 million nurses are expected to retire worldwide in the next 10 years. Dr. Bianami, how can the Louisiana Action Coalition strengthen and prepare a diverse nursing workforce?
Good morning, and thank you, Dr. Chapman, for giving me the opportunity to participate in this conversation this morning. I'd first like to say that Dr. Sue Hassmiller's presentation was right on with our strategic plan. It was very exciting to hear what she had to share with us. As Dr. Chapman said, I have the privilege of sharing with you, just expounding more on strategic priority A, which is to strengthen and prepare our nursing workforce. In terms of our challenges that are facing our nursing workforce in Louisiana, I'd just like to share a few, not all of them, but just to kind of put us all on the same page. For instance, according to the Louisiana Nursing Workforce Supply and Demand Forecast Model, it was projected that in 2022, we would have a shortage of over 5,000 registered nurses. Well, we exceeded that projection in 2021 with the surge of the Delta variant. So before the pandemic, we were in a shortage. After the pandemic, that shortage has been amplified. Nurses are experiencing fatigue, as Dr. Hassmiller said, burnout, suffering from mental and moral injury. So we're having to address those issues, which is a priority for the Action Coalition. There are regulatory barriers in Louisiana that prevent our nurses from working to the full extent of their education and training. Again, those are areas we must address. Nurses are migrating from the bedside, and this is not only in Louisiana, but this is around the country. In Louisiana in 2020, over 1,300 qualified applicants were not admitted to our schools of nursing. And there's various reasons for that: not enough qualified faculty, not enough budgeted positions, not sufficient clinical spaces. So again, things we must address. Between 2016 and 2020, we had 106 nurse faculty to retire. So what can we expect for the next 5 years? These are challenges we must address now. Of course, the COVID pandemic amplified the long-standing disparities and inequities that disproportionately affect minority communities, such as maternal health, maternal mortality in our state, which exceeds that of the country. Then redlining, as Dr. Hassmiller mentioned, that impacts, again, those social determinants of health that impact health and health outcomes in our state. Statewide, 13.7% of Louisiana's population is Black African American. Yet in 2020, only 17% of the RN workforce was Black African American and 15% of the APRN workforce. So again, these are just some of the challenges that face Louisiana. So looking at our first strategic objective, promote innovative programming and best educational practices. First of all, I would like to say give applause to our nursing schools in the state of Louisiana for the awesome work that they did during the pandemic, role modeling for our students, helping our students to see the importance of working in the community, what they can do in terms of a crisis situation within our state. So again, dealing with virtual classrooms, dealing with simulation. So I'd like to applaud our nurse educators in our nursing school. Yet, as Sue Hassmiller said, there's much work to be done in terms of our nursing education, in terms of putting that lens, that health equity lens, asking our students to begin to look through that health equity lens in terms of all areas of the curriculum in nursing, decreasing health disparities, identifying those health disparities. How can nursing participate? How can our students participate in decreasing those health disparities? Telehealth. Incorporating more in terms of telehealth, in terms of the curriculum, dealing with interprofessional collaboration, and as Sue said, multi-sector collaboration, the importance of that. Health policy, cultural humility that she mentioned twice, at least twice in her presentation. And again, as I said, our schools of nursing did great work in terms of simulation and virtual didactic and clinical experiences during the pandemic. Again, expounding on those work, making sure that all students have access to internet services across the state. And of course, we're still continuing to deal with the faculty shortage. Our faculty in our schools of nursing are about to begin the new generation NCLEX exam. I think that begins in 2023. So there are many challenges that are facing our nursing education in our state, both at the undergraduate and the graduate level. And so the Action Coalition are working together, multi-sector, with multi-sector stakeholders to address these issues and to do the work that's so needed. Next strategic objective is support current nurses in career progression. It's so important that we encourage our nurses at all levels, from the CNA to the graduate level nurse, to continue with their education. I looked at some of the data, and some of the data from our Louisiana State Board of Nursing show that there has actually been a decline in the number of nurses that have gone to get there. They're enrolled in our BSN programs in their state. Between 2016 and 2020, there was a 12% decrease in the number of students admitted to our RN to BSN programs, and also a 13% decrease in the number that graduated from our program. So this is a challenge that we must address. In terms of, as Sue had mentioned in our first report, there was a recommendation to increase the number of RN prepared nurses, BSN prepared nurses, to 80% by 2020. Well, we did not make that 80%, and I think only one state in the United States may have made that. But we did a great job. We went from 50% to 61% of our nursing workforce having a BSN or higher degree in the state, and that exceeded the national campaign, which was 59%. In terms of another recommendation was to double the number of doctorates in our state. Well, we far exceeded that. In terms of our DNPs, we actually increased the percentage. We went from 34 DNP prepared nurses in our state in 2010 to 670 in 2020, and over 1,870% increase in terms of our DNPs. But for our PhDs, we went from 93 in 2011 to 132 in 2020. And as Sue said, we really need to focus on increasing the number of PhDs. In terms of student residency programs, we have some exemplars in our state, but we need to make sure we provide residency opportunities for that transition from education to practice to all students, excellent residency programs. So again, there's much work to do improving the diversity of our students and also our faculty. Our next strategic objective is to create and foster opportunities to diversify the nursing workforce. One of the interesting things that, and I'll quote from the actual report, is that the decade ahead will demand a stronger, more diversified nursing workforce that is prepared to provide care, promote health and well-being among nurses, individuals, and communities, and address the systemic inequities that have fueled the wide and persistent health disparities in our state. How can we address that? Again, I have some data for you in terms of the number of students enrolled. In 2000, we've gone from, between 2015 and 2020, a 34% increase in the number of Black African-American students enrolled in our nursing programs. And that's wonderful, that's great, we've made some great progress. But something that may be concerning is that we've only increased the number of graduates Black African-American graduates from our programs by 1%. For example, we had 445 Black African-American graduates in 2015 from our nursing programs. In 2020, we had 450, only an increase of 5 graduates. So again, that's information that we can use and really use to target and improve the diversity, to address the diversity of our nursing workforce, because that's our future nursing workforce. We must also look at the leadership in terms of, as Sue said, only 10% of the leaders in nursing leaders are from minority populations. Again, we have to address that. The Action Coalition, we have a Nurse Leader Institute, and I'm sure that's done. Someone's going to share a little bit about that. But we need to be strategic and make sure we're strategically including and preparing nurse leaders from minority backgrounds. The next, in terms of supporting the health and well-being of current nurses. As Dr. Kaur said, that, as you can see, that's highlighted because that is truly one of those targeted areas. Even though all 4 of these are important, we want to make sure that we're looking at, when you're in a crisis situation and you're coming out of a crisis, you have to take care of those that were implemented at the front line of that crisis. And that's what our concern is. There are many programs available out there in order to support our nurses, but one of the things in the literature and that we're actually seeing that nurses are not always taking advantage of those programs. And there's reasons for that. Maybe they don't really feel supported in doing so. Maybe they feel that there's a stigma associated if they seek out support in terms of mental health support. But we must address that. We must make them feel comfortable in seeking support from their employers. And this is not just an employer, this is education. As Dr. Kaur said, we must look out for our nursing students as well. We must look out for our nurses that are employed in large healthcare centers that have been at the front line, that have been dealing with death on an enormous level. How can we take care of them? We can't forget their needs. So again, these are just 4 of the strategic objectives that we're going to be implementing and addressing. We really would like to hear from you as we move on with this conversation as to how you feel you can be a part of this process. Thank you, Dr. Jackman.
No, thank you, Dr. Bianemi. That was awesome and amazing. Please use the Q&A if you have any questions for any of our panelists during this discussion. And so, Dr. Lyons, the achievement of health equity in the United States should be built on a strengthened nursing capacity and expertise. For the United States to advance health equity for all, the systems that educate, pay, employ, and enable nurses need to either permanently remove barriers, value nurses' contribution, prepare nurses to advance equity, and diversify the workforce. How do boards of nursing play a part in alleviating barriers or help to strengthen nursing capacity and expertise?
Well, that's a great question, Benita. First of all, when we talk about permanently removing barriers, people normally think about removing barriers to APRN practice, but that's really not all that we're talking about here. Certainly, LSBN has been very active with our partners in the Louisiana State Nurses Association and the Louisiana Association of Nurse Practitioners to advance and work towards supporting legislation that removes those kinds of barriers. We haven't gotten as far as we'd like. We came very close in 2020 and 2021 and working again towards that in, I think, a smaller way in 2022. And we hope that happens. But it's not just barriers to APRN practice, it's barriers that keep all RNs, APRNs, nursing assistants, everyone, allied health members, who are not allowed through processes that may exist in their organizations or policies and procedures that don't allow them to practice to their full extent. From the standpoint of barriers to our students and to minorities, it's particularly important that we think about those things. Dr. Bianemi presented a lot of statistics, but let me just say that in our last nursing supply survey, we know that 38% of licensed RNs that reside in Louisiana are 50 years or older. 18% of them are 60 years of older. Now, what we were told during the pandemic and what the communications that I had from nurses around the state were that a lot of these older nurses who had been looking forward to retiring, the stock market, was surging, the economy was fabulous. And then the pandemic hit, many other factors that have now affected inflation. And so, but those nurses stayed on. They were going to retire, but they stayed on to help. They stayed on to help in education as education tried to transition. But those people are tired and they're going to be looking to retire, and that's going to exacerbate the shortage that we already have of nursing faculty. And I know that Dr. Porsche will be able, when we get into questions and answers, to talk a little bit more about that. Another shortage is with men in nursing. Right now in the state of Louisiana, men only comprise about 12% of our RN workforce. That's very similar across the country, but we have to figure out ways to encourage more men to come into our profession. We have a lot of men that come into the APRN roles, and those are higher, probably around 15 to 16%. Particularly in the areas of acute care, nurse practitioners in adult gerontology in the hospital, CRNAs particularly. It's a very popular field for our men in nursing. So, but we have to, we need those people at point of care in the hospitals taking care of patients to figure out how we do a better job of recruiting men. Minorities, it's another thing. Only 3% of the nurses in Louisiana are Hispanic and Latino. So the needs of our Hispanic and Latino patients are not always met because we don't come close to matching. Across the United States, the Hispanic population has grown to 14 to 15% of the population. And yet, in our state, we have a 3% Hispanic nursing workforce. Minorities currently comprise 41% of the Louisiana population, and yet only 20% of our nursing workforce is minorities. So in terms of diversity, equity, and inclusion, we need to do a better job of figuring out what are those factors that are keeping these students from coming into our nursing programs. And I think a lot of it has to do with just like social determinants of health influence the health outcomes of our patients, those social determinants of health also influence what students can come into our programs. The depressed economy, how many students can afford to pay for tuition? How do they get assistance? What kind of grants and aid and tuition assistance is available to all of these people? So those are all things that, that we need to think about and work on in terms of the, removing barriers for the nurses that, the nursing students and people coming into our populations. So a couple, there's some other things in here that talk about valuing nurses' contributions. I think we're doing a much better job, particularly at the State Board of Nursing, to work with our partners on valuing nurses and posting. And we've had a lot of accomplishments during the pandemic in terms of strengthening nursing education practice and workforce. And, we worked very closely with the governor's office during the health, the public health emergency for doing waivers and allowing nurses to come into our state to practice if they had active unencumbered licenses. And that really helped at the beginning in the surge when COVID first hit, and in all of 2020, when we were at the top. You know, New Orleans was, I think, #1 for a while in terms of numbers of patients with COVID and deaths from COVID. So, you know, I think we're doing a lot more outreach in terms of working with our partners in the community, both in education, practice, and administration, to try to look at ways to improve the numbers of students coming into nursing. But I can tell you, the problem for us isn't that we don't have enough students that want to enroll in our nursing education programs. We do. But of course, as all of you know, that have gone through a nursing program, we're limited by our student to teacher ratios that we have to have in clinical settings for the students to be safe. And so we don't have, you know, the lack of faculty and the open positions of faculty we have in the state, and the lack of clinical sites, the challenges for getting enough clinical sites for students to practice and to learn their skills and to, you know, progress in their nursing education are limited. So every year we have from 1,000 to 1,200 qualified, fully qualified students who could get into nursing programs and improve our numbers, but we can't get them into our nursing programs because there's not enough capacity. So when we talk about workforce, I think we're doing a lot. The HealthWorks Commission, that is also led by Dr. Porsche, is working diligently to try to figure out ways to improve funding for both students and faculty to get them into the workforce. So I don't know if you have other questions for me besides those that I've addressed.
No, Dr. Lyons, that's good. I'm gonna circle back to you after I talk with Dr. Rooney. So Dr. Rooney, policymakers need to expand the scope of practice for advanced practice registered nurses, including nurse practitioner and registered nurses, as Dr. Lyons has already explained. What is LSNA and other nursing organizations doing to expand nurses' role to influence policy regarding health equity and the social determinants of health?
Well, thank you so much, Benita, for the great question and all of the great comments from the panelists before me. I think one of the main things that LSNA has done is partnered with other nursing organizations like the Louisiana Association of Nurse Practitioners. And we have also, worked to establish relationships with about 30 other nursing organizations in the state to really expand, number one, address our issues of expanding the scope of practice for nurses. And I think it's really important for us as nurses to fully understand what that means. And so what does practicing to the top of your practice mean for someone who works at the bedside, or the top of our practice for someone who is an advanced practice nurse? And as we look at right now, several pieces of legislation that have to do with removing the requirement for a collaborative practice agreement to allow nurse practitioners to practice at the top of their scope. We fully support this. It's written into our Future of Nursing publication that was just published last May. And I think it's a hugely important piece for us to understand how these collaborative practice agreements really don't do anything but have the agreement that there will be a person that I can escalate my concerns to, which is how we practice in healthcare anyway. And so learning the issues, learning the problems was probably one piece. Communicating that with our members is another. And really supporting the organizations and promoting the legislation that they hope to see passed related to full practice authority for our nurse practitioners is just one way. In addition, our strategic plan for the organization includes twice actually pieces related to increasing and improving the diversity of our nursing workforce. And based on all of the data that Dr. Bienemy shared, which I'm very familiar with, it is shocking for some to realize the lack of diversity that we have in so many aspects of our nursing career, nursing workforce here in Louisiana. And so I think number one, bringing that awareness to people. A lot of people are shocked when they hear that we don't have that we have 17% of African-American nurses in Louisiana, or that we have 3% Hispanic nurses, and that we, only have less than 20% of male nurses in our profession. So understanding that data and then sharing that to kind of give us a place to understand where we are starting is one piece. Another is that we are looking at collaborating with a group of other nursing organizations, and including the Louisiana Hospital Association as well, and the Board of Regents, and many different groups that are helping us facilitate a collaborative discussion around removing these barriers. And so we're going to try to bring nurse leaders, academicians together in the fall, and nursing students to try to understand what our greatest barriers are, and figuring out ways to hopefully find a means and a path to lifting some of these, and agreeing that there are some pieces that just don't work when we're looking at the goal of expanding our nursing workforce to the level that we need to in order to have a strong nursing workforce, not just right now, but in the future. And like Dr. Lyons said, so many nurses are at retirement age. This was anticipated so long ago, but here we are at that point where we have to understand, how are we going to backfill the jobs, the knowledge, the gaps. And so another piece that we are working, and you're very familiar with this, Dr. Chapman, because we are working together with a DEI task force for our organization, Louisiana State Nurses Association, to really dig into what are some of our bigger barriers, bringing awareness to some of the issues. We've had several opportunities for education, and to shine a light on the issues that may not be front and center in many people's awareness. And I think that besides this, we also, during our membership assembly last year, this task force is formed out of two separate resolutions that were brought forth by our body, membership body, that said this is a priority. It has to be. And so one of them has to do specifically with admissions and making sure that our admissions are equitable and processes. And then the other has to do with really bringing in more diversity into our workforce, and not just diversity, but then also looking at understanding all of the pieces that are related to creating an inclusive atmosphere and environment, including having people who are mentors and willing and excited to mentor BIPOC, and having a different anyone who has like a different experience, really bringing those people in and helping us in our organization, not just our board, but across our organization, to really start to become more inclusive and really see more, hopefully, members. And that's one of our bigger priorities as an organization, is to really expand our membership of the Louisiana State Nurses Association. 99% of physicians are members of their professional professional medical association, the AMA. But we don't have those kinds of numbers here in Louisiana. And while the Louisiana State Nurses Association represents every nurse in the state, what we don't have is the membership that we would love to have. Everyone's voice matters. Nurses' voices matter, and we want to hear their voices as an inclusive part of this organization. And so my hope is that we can continue to grow the body of membership, so that we can continue to pull in more voices into this dialogue, which is going to be an ongoing dialogue, at least for the next 20 years, of making sure that we are fortifying and creating the most inclusive workforce that we can identify.
Thank you, Dr. Rooney. Dr. Porch, this question came in, and it really could go for anybody, but I was thinking that you may be better to answer this question. The question is on giving the need or the importance of diversifying the workforce, the nursing workforce. What are some actionable items that schools of nursing can institute into their organization to move that forward?
Well, first thing that comes to mind is definitely a strategy that we have is trying to recruit our own. So as they're exiting your baccalaureate program, make sure that you're starting to talk to them about graduate education, those minority and students, and then helping them and assisting them to be successful through graduate education. And then also make sure that you get them in. And once you get them through the graduate program, you get them hired before they actually start exiting the door. But the other thing is making sure you have a representative faculty. And I think that's one of the things that I'm proud of, that it's been a challenge for us here at LSU, but we have succeeded on several fronts, and not only making sure that we have minority faculty on board, but we have minority faculty that have actually succeeded up into leadership position. So those are two of the critical things I would offer, but open it up to the other panelists too.
I would also like to add that when we have our minority students admitted to our programs, it's so important that they have the resources available to them to be successful, be it mentoring, be it some type of stipend, being it because as we know, many minority students come to our programs, maybe single moms or single dads having to work full time, those kinds of things. So I also think this is one of those opportunities to come together multi-sectorally, as Dr. Hassmiller said, and bringing in other sources. The chamber, whatever, if we can develop funds and find a funding source to help these individuals, because we can get them into our programs, as we can see with the numbers that I shared, but are they being successful in completing our program and passing the NCLEX and becoming a member of our profession? We have to go from the beginning to the end, and we have to provide the resources that are needed. It's not that these students cannot be successful, it's that they may not have the resources in order to be successful.
Great point, Dr. Bianemi.
I think it's interesting what Dr. Porsche said about growing your own. Those of you who are out there that are thinking of doctoral programs or even master's programs, if that's where you are in your journey towards higher education, up the education ladder, and Demetrius, I know, knows this because we both come from academic climates where that was not historically what provost wanted. Provost wanted you to go somewhere else, get a degree somewhere else, practice somewhere else, and then come back. So that is such a new and refreshing philosophy about trying to grow your own. The other thing I want to say, just to make sure that you all understand, there was reference made to I think Dr. Bianemi talked about the next generation NCLEX that will be starting up for pre-licensure students, the entry, examination, NCLEX RN and NCLEX PN. In April of 2023, I represent the National Council of State Boards of Nursing. I'm on the board, and I'm the liaison, the board liaison to the NCLEX examination committee, and we actually just met yesterday. So, and one of the things we're getting ready to do in preparation for that launch is to have the expert panels actually looking at all the new types of questions that will be on the next generation NCLEX. And I want to assure you that we went through the whole panel yesterday, and we had assigned, selected people, and then we had alternates, and we did some movement around to make sure that we had not only diversity of, making sure we had medical, surgical, critical care people, pediatrics, OB, psych, mental health, community, public health, all that, but also diversity in the minority representation, in having men on our panels. And so that we get, a reflection of how different groups can interpret questions. And it's been a fascinating experience for me to see how different cultures you'll think this is a very straightforward question. And from a practice perspective, the answer is very clear. And yet we were looking at something where the Asian students were answering it really differently, and we couldn't figure out why. And then you start thinking about their cultural perspective and how they think about family, and it became clear about that. So there's a lot of work behind the scenes just to, to make sure that all of you out there, particularly if you're educators, to understand that there's a lot of diversity, equity, inclusion factors that have been considered in developing that next generation NCLEX. And to make sure that we, the whole reason for that launch 5 years ago was to make sure we were asking the right questions of nursing. As nursing moves from our very traditional kind of medical model that we had in nursing education to competency-based curricula. And I know Demetrius knows a lot about that. And as we're all transitioning and transforming our curricula to reflect competency-based education.
Thank you, Dr. Lyons. That's a great point that you just brought up, meaning that there has to be some intentionality in making sure that we are diverse, not only in the population that we serve, but also in the way that we see things, and making sure that everybody that needs to be at the table reflects the diversity that we hope that we're communicating as we graduate some of our graduates from our schools. Dr. Rooney, did you want to say something? I saw you.
I just wanted to add, I think another competence that we need to really develop is clearly emotional intelligence in a lot of situations. And that will help us guide, I think, a lot of these initiatives, because we cannot have inclusion when we have a high degree, I would say, of lateral violence. And especially since the pandemic, we look at some of the data from the the American Nurses Foundation that came out on people's feelings. How are you feeling? And what we're finding is a lot of people are saying, I'm irritable, I'm frustrated with others, I'm judgmental of others, I feel cynical, I feel, sarcastic. And some of those things really obviously impact our human relations. And so without the ability to learn how to filter our comments and be kind of more neutral, a lot of times you'll just see two colleagues talking and there may be a third person just waiting to talk to them. And the longer that person stands there without being acknowledged, it creates kind of this feeling of, maybe I shouldn't be standing here. It's not that inclusion of, oh, Dr. Porsche, do you know Dr. Lyon? Have you guys met? Just being able, this is Ikoy, she just started working here, so that ability to build bridges between nurses, the ability, starts with onboarding a brand new nurse and making them feel welcomed and shored up and supported. It even has a complete different ramification when we're looking at people who maybe even never saw themselves in this field, maybe never even dreamed of the ability to be attending a university, and now graduating as a nurse, and those dreams that are wildly huge for some people that just don't even seem possible. I think the ability to have people reassure you along the path. I think about Supreme Court Justice Jackson and that story she tells about being at Harvard, where she just didn't feel like she belonged, and someone kind of leaned in and said, persevere. And I think that needs to be our message as nurses. And that is the piece that I feel is probably the biggest drum I beat, is that we all need to be kind to each other. We need to support each other with unconditional positive regard, loving kindness, and really be available to mentor people. We need to be at the ready. When people ask us questions, we need to be able to demonstrate that, while we are the most trusted profession, we are also the most trusted people. And so as individuals, we really need to carry that torch of being able to not just deal with all of the structures, but then also live that truth, so that people will come into our profession and feel welcomed.
Dr. Chapman, I'd like to just add from what Dr. Rooney was saying. I think an extension of that, I think Ikoy is moving from emotional intelligence to social intelligence, with basically, and what I heard you saying, with an open mindset, but being an authentic leader at the same time is really critical. And the other thing I would just, as another related comment about something we talked about, really making sure that we have those nurse scientists And then also making sure that we address the students' social determinants of health so that they're successful. There's a lot of programs or schools, universities that offer the PhD degree. Part of their mission and responsibility is producing those nursing scientists and making sure that those scientists are out there, being developed. So some of those programs will actually support you through your PhD education, and you don't have the financial burden of tuition in a lot of those PhD programs. So, for those of you that have a DNP, definitely consider a PhD and extending your doctoral education. And those of you with master's or baccalaureates, consider going into a PhD program and making sure that we have those nurse scientists. So I wanted to pull those thoughts together because a lot of times those PhD programs are that their mission is producing that scientist. So they're going to fund that person to become a scientist.
Thank you, Dr. Porsche. I have a couple of questions actually for you all. So I want to make sure we get them addressed before the panel ends. One of the big issues I have noticed in the student body with minority populations that are struggling is with the communication barrier with English as a second language. Nursing school is difficult on its own without this added issue. Any suggestion on how to assist with this population?
Dr. Chapman, let me just say, because having come from Texas Women's University, where I was dean at the Houston campus, we had a lot of students from all over the world. We had students from Nigeria, from Vietnam, from all over different parts of Asia. And actually, our issue was not so much that they knew English very well. They knew English sometimes better than the Americans, but their big problem was accent modulation and practice and being understood. And so we developed a program for speech pathologists to come in and work on accent reduction with them that made it easier for them to be understood. They knew the English language very well, but they had a lot of problems with accent.
Thank you, Dr. Lyon.
Dr. Lyon, I would say in addition, I think that a piece of it is incumbent on us to learn how to tune our ears to different accents. When we live in a world where we don't have a lot of experience or exposure to other accents, I think that is really one piece that can help us. I was with my daughter the other day and she was having trouble understanding someone who was speaking with an accent. And I said, oh, wow, there it goes. I need to help her tune her ear so that no matter where she is or who she's with, that she can really try to tune in and pay attention. And it is a competence. When you start to develop the ability to understand better too. So I think both ways that is a very helpful. I love the concept of a speech pathologist being involved. That's so innovative.
That is. Thank you, Dr. Rooney. Anybody else? The next question is, have there been business cases made where states that support nurses practicing to the full extent of their knowledge and licensure have a healthier population and have decreased hospitalization and other healthcare costs? Have there been any business cases that you all are aware of where we've seen improved population as far as their health, given that nurses are able to practice to their full extent of their license?
I can just add that there's literature, and there's been literature out there for a while. I think one of the times that a bill went toward the legislature a few years back, we pulled loads of literature that supported that the care given by nurse practitioners was equal to or supersedes the care that was given by other primary care physicians. But I think there's also literature, I can't name it now. We can investigate it and provide that later. That even shows the economic impact of care administered by nurse practitioners. I think we don't like to say that the care is cheaper than the doctor, because it shouldn't be if it's equal. But the reality is that in many cases it is. But again, the care is in terms of improving healthcare outcomes, is equal to that of a physician. So yes, there are studies and out there that can support that.
Thank you, Dr. Bianemi. Have there been discussion with hospitals to share utilization of employees who wish to be clinical instructors, but the pay is not attractive? How can schools of nursing partner with hospitals to make clinical instruction more attractive?
Well, I'll just take a little bit. A lot of hospitals and schools of nursing or colleges of nursing have engaged in what's frequently called an academic practice partnership, and that's basically it can be an informal, agreement, or it can be as formal as a contractual relationship between the two. And the beauty of those is a lot of times those hospitals continue to pay those nurses their salary while the nurses have dedicated time to actually teach clinically or actually sometimes teach didactically in the schools of nursing. And that is really helping a lot and helping with the burden of nursing education and the workforce issues that we're dealing with around nursing faculty shortage. So those are definitely happening throughout the state. I know several schools of nursing in LaCaine are actually involved in numerous types and different arrangements and relationships where they're trying to access those quality resources within the clinical setting. So it is definitely, I think, one of the keys answers to our issue with nursing faculty.
Thank you, Dr. Porsche. Was this somebody else who was gonna say something? I thought I saw someone else.
Yeah, well, I mean, what I would say is my experience is the same as Demetrius is in that regard. Having a clinical nurse that works for, let's say, Oxnard and is making that salary, if 50% of their time can be donated or contractually given to LSU or whoever, then that salary is much bigger, greater than what we can pay an adjunct an adjunct clinical instructor that works for the university. So that's why those kinds of academic practice partnerships make so much sense, and they work very well. Of course, every hospital can't give a huge, they're operating on very small margins as well in terms of running their facilities. So they can't do maybe a lot of that, but every little bit helps.
That's right. Thank you, Dr. Lyon. So one thing that I got from the report was the big thing about collaboration and about organizations, whether internal, meaning that within the profession or outside of the profession. But I also wonder, and I don't know if any of our panelists can speak to that, how either you or if you know of other organizations that are collaborating in order to move this agenda forward as far as us going beyond our health equity, but also making sure that we are creating a diversified nursing workforce, and how are we collaborating with either within our own system or outside of our own system to meet some of these objectives.
One of the things I'll begin with an offering is that I've seen throughout the state, and I think the pandemic has helped a little bit of this because so much attention has been on nursing. It says there have been philanthropic foundations that's come forward and actually partnered with schools of nursing and given monies for scholarships or to support faculty. So I think that some of those philanthropic organizations were catching their attention. The thing now is if we could really have other industry partners, non-healthcare related, to partner with. And I think that's one of the things that's on the Action Coalition's agenda, is to bring those stakeholders in so that they could, help maybe fund scholarships or fund faculty positions.
Thank you, Dr. Porsche.
I agree with Dr. Porsche. One of the long-term challenges for the Action Coalition has been getting our non-nursing partners to be a part of our leadership team, because we recognize from the beginning that this is not something that nursing can do alone, that we have to include those stakeholders, those advocates for nursing. And now with the social determinants of health, we know we have to go outside of just nursing to get these things done. So it's so important. I'm currently reading an article that the state of Washington did in order to get an increase in salary for nurse faculty through their legislature. And they had to include, it was a multi-sector group that went forth and made this successful. So yes, we definitely have to reach outside. And so that has been identified as one of the challenges for LAC. And that's what we're going to be addressing over the next few years.
Thank you, Dr. Lyon. Dr. Rowe?
Yes, I just wanted to say, on the heels of what you are saying, I think that also including more nurses in other sectors and organizations. So our Nurses on Boards initiative has been huge. It started with LAC and now it's in the Louisiana State Nurses Association umbrella. But we are so proud of that work that's happening. We're really looking at an increase in numbers of nurses that are serving on boards and commissions so that the nurses' voice, perspective, needs are heard in all of the different organizations and sectors, anything having to do with health policy, nurses need to be at the table.
That's right. That's right.
I'd like to add to just a little, to deviate just a little bit, because I wanted to, and Dr. Rooney probably could expound on this more, but when we're talking about supporting the health and well-being of our nurses, I just want to say that there are two bills that are being introduced, I think, into the legislature this session. House Bill 312 dealing with workplace violence, addressing workplace violence in the workplace, and also Senate Bill 195, the safe harbor protections for nurses. So again, this is using health policy. And I think it's so important for us to know how the two interact to really address issues that are impacting our profession. So I just wanted to put that out there.
Thanks so much, Dr. Bienemy. And I don't know if I need to expand on that. I know that we've been sending messages out through social media, especially over the past days, to our members. And so if you're not familiar with these bills and how they can potentially impact the work environment of nurses and other healthcare providers, I would encourage you to go to our website, go to Facebook, our social media posts, LinkedIn, Twitter, and try to learn more about those pieces of legislation and talk about it with your colleagues. There's an action item for both of them where you can actually write to your legislators in support of those two pieces of legislation. It's pretty easy to support. You just have to click and put in your zip code and you'll be communicating with your legislators.
All right, so I'll take this time to let the panelists say any lasting words before you all move on. Anything we want to talk about when it comes to how we collaboratively as a coalition can move this work forward? Is there any lasting words?
I'm going to say, and I'm going to use Dr. Rooney, you used this in 2020, and I'm going to use it now. It's not about competing, it's about completing. It's about all of us working together for the common goal of not just improving our profession, but it's the ultimate goal is to improve healthcare for the citizens of our state, and nursing being the largest sector of our healthcare workforce. And now it has an eye, there's truly an eye on how critical nursing is to the health of our community. It's an opportune time for us to really make a difference. So thank you.
Thank you, Dr. Bienemy. The Future of Nursing 2020-2030 report was undertaken to explore how the nursing profession can be transformed to help exploit these opportunities and contribute to building a healthcare system that will meet the demand for quality, safe, and patient-centered, accessible, and affordable care. The next 10 years will test the nation's nearly 4 million nurses in a new and a complex way. So nurses are going to have to live and they're going to work at the intersection of health, education, and communities. The report calls for us to change at both the individual as well as a system level, which means that it constitutes a call for action, which is what we're doing now, where the nation's largest healthcare workforce, which includes us, but not only us, but nurses in all settings that Dr. Rooney explained, to listen, to engage, to deeply examine our current practices, as well as collect evidence and really move forward, act and move forward. So while it's great that we're having this discussion, if all we do is discuss and not actually act upon what we're discussing, we're still going to be in the same place we are now, 20 years later. So the committee's recommendation really targeted actions that required policymakers, educators, healthcare system leaders, and payers to really enable this crucial change. I ask that each of you take today's conversation and figure out how do we, in our individual organizations and system, move the recommendations forward in a way that moves not only the nursing profession, but moves how health equity is done now and provide an accessible and affordable care for all. So thank you all so much for my amendable and wonderful panelists for being here today to assist us as we move this discussion forward.